Now, trying to look at another type of amputation, and this is an amputation that is actually through the tibial bone, and they call this the transtibial amputation. Okay, so I try to cut the leg, and this is like through the tibia. Okay, that's below the knee. So let's look at it and also look at reasons why, so we have below the knee and also transtibial, stuff, removal of the leg. So this is below the knee amputation. Okay. So below the knee amputation, we said that is a surgical removal of the leg, and you are doing this through the tibia and the fibula. So that's below the knee joint. It's actually one of the most common lower limb amputations, and is generally preferred over the above knee. Why? Because at least you are preserving some of my leg, and to make me feel less, lonely without the leg, so to say. So why would I actually need to cut somebody's leg? Different things could cause that, right? Like there was a lot of trauma, or there's a lot of cancer, malignant tumors of the lower leg. So infections, where there's severe osteomyelitis or gangrene. So vascular disease, that's like, you have all this peripheral artery disease or diabetes. It leads to a lot of tissue death. There's sometimes you have some congenital malformations where you basically just have to, just cut the leg so that you can basically put a prosthesis which will be much more, better and presentable. So surgical procedure, we said that the tibia and the fibula are cut at the location which is best seam fit, and muscles and the skin are shaped to create a functional residual limb. The nerves will be managed to reduce pain and prevent any neuronal formation, you understand? So that when you put a prosthesis, it's not pressing on the nerves and causing a lot of pain and numbness. So the stump is closed in a way that allows for prosthetic fitting. So rehabilitation prosthesis, so we have the transtibial prosthesis. They're easier to use than the above knee prosthesis because the knee joint is preserved. We also have physical therapy where I focus on strengthening, balancing, and gait training. There also occupational therapy where you help the patient adapt to their daily activities. They will have the psychological support, which is very important for coping with limb loss and adapting to new life circumstances.